Today we're going to be taking a much closer look at medicinal cannabis in Australia. And with more than 100,000 patients in the region, it's definitely a market of interest. However, please be aware that you do need to have a prescription for CBD products in the region, so the THC numbers are definitely not that high. Now, all of this goes back to 2016, where TGA approved the cultivation of medicinal cannabis in the region. We do know to date that there's well over 45 medicinal cultivators, as well as there are research permits in the region provided. TGA does not require all license holders to be listed publicly, so you can anticipate much more hidden from public scrutiny. What we do know in the public space is that a lot of these cannabis cultivators are listed on the Australian Securities Exchange, which provides us with some good understanding of what is happening in the market, along with data sources like Fresh Leaf Analytics by Reese Cohen that provides valuable insights into the region. We saw as well that the TGA approved through what's called special access provision at least 30,000 patients in the first 3 months of 2022. We also know that you can get access via an authorized prescriber scheme in the region. So it's definitely a very fast enablement of access through prescriptions. In addition, I'd like to highlight the fact that if you're looking to participate within the Australian market, the one thing you need to pay close attention to is regulations related to TGO 93 and 100. 93 is particularly important because it really outlines the details associated to what's required to get product into Australia. In addition, we saw some updates throughout the year where they spoke about GMP approvals by vendors to be listed for the importation of cannabis into the region. I ultimately have Sibusiso Xaba on today that's going to provide us some additional insights into the Australian market, as he's just recently returned and we had a chance to chat to him about visiting cultivators as well as dispensaries or pharmacies. Enjoy the episode. Hi Sibs, it's great to have you on today. I know you recently just came back from Australia where you were attending a conference and you had an opportunity to engage with cultivators in the region, pharmacies in the region. Maybe you can give us a bit of insight in terms of why you went out to Australia and what were you looking to achieve in the other Southern Hemisphere country.
Sure. Always great to be on, Jeff. So Australia is, I think, one of the most important legal cannabis markets in the world today. Australia is probably South Africa probably is 4 or 5 years behind where Australia is currently today. So Australia's got over 100,000 medical cannabis patients, growing very, very quickly on a month-to-month basis, and is actually one of the most accommodative jurisdictions in terms of importation of cannabis, and also one of the most well-funded and most well-established cannabis industries in the world. So Australia is importing cannabis, exporting cannabis, processing, investing in research, and in many ways is a much more mature cannabis economy versus South Africa and Lesotho, for example. So from our perspective, we need a lot of people that we've been talking to and working with for some time, but also expand our network within that market, and also get a much more granular understanding of the mechanics of how that industry works, to sort of have a good foundation for us to further expand our work within South Africa and support South African cannabis operators enter the Australian market, and also help sort of position some Australian players who are interested in investing and participating in the African market, really kind of have an understanding of what the lay of the land is here.
Awesome, excellent. And I just want to give some context there. So in Australia, when we talk about 100,000 patients, it is important to remember that CBD products do fall under the prescription or the special access provision. So a lot of that can be CBD products, not just, don't think of it as an audience as 100,000 THC scripts that are being filled. There's really two routes to market there. There's the special access provision B, and there's obviously the authorized prescriber scheme, which is also being implemented and moving forward. And when you're right there, Sibs, there's over 300 products that are kind of approved in the market there. There's different levels of approval, so I won't talk about not necessarily like a traditional marketing authorization, but there's a range of options, and there's a lot of interplay between South Africa and Australia, and it always has been. And I want to ask you the next question in terms of did you have an opportunity, because I know you were there for a conference, did you also get a chance to see some of the local cultivators, see their facilities? What did you pick up in terms of, are they doing things differently to how we do? What was your view on that?
Yeah, so we were quite fortunate in that we actually interacted with quite a lot of local cultivators and operators, and managed to actually visit a facility pretty close to Brisbane. I think there was a couple of things that really stood out, and that really gave me a sense that we still have quite a long way to go. Look, we have a long and rich history in terms of the cultivation of cannabis in South Africa and Africa. But to understand cannabis as a medicine, how to produce that, how to, sort of ensure quality, how to be innovative, and how to stay ahead of the curve, it's a completely different skill set that I had the sense that let's say this one cultivator we visited in Australia had. There was a very strong focus on innovation, agile learning in terms of the operation and the process, as well as scaling in order to meet domestic demand. The other key lesson, I think, from sort of the facility visit and sort of engaging with a lot of the local licensed producers was just how much collaboration was happening in that market versus South Africa and Lesotho. On the visit, we actually met another cultivator that we had been speaking to for some time, who just happened to also be visiting the facility and engaging with what would, quote unquote, be one of his competitors. And for me, that's something that was extremely, in some ways inspiring to see, because I think in the African cannabis industry, we do tend to be very siloed, and everyone tends to hold their cards very, very close to their chest. And so in this sort of early stage of the industry where collaboration can help in the collective problem-solving process of the industry, I think we are a little bit handicapped in that operators are not that trusting of each other, and and understandably so in terms of human nature, etc. But I think that's one of the barriers that we're going to have to break in the African cannabis industry in order for the industry to advance at a much more sort of compelling pace and to solve collective challenges and issues that will actually allow the industry to get on both of its feet.
Awesome. Yeah, I agree with that. I mean, we want to see a more collaborative effort. I mean, to problem solve by yourself is one thing. To work with everyone to problem solve, I mean, if the market is really out there and we've got to fulfill it, then you've got to work together to understand what are the problems. Like, learn from someone else's permitting issue. What was the delay? Where were the hiccups? What testing labs the best to recheck your results? Is there other options? And I want to ask as well, because I mean, there is this aspect of, in terms of commercialization for access. With over 100,000 patients in the region, the SAS-B approvals is always like on record highs. What was I know you also said to me, I know we spoke about it briefly, you mentioned you went to one of these pharmacies that dispenses, so it's not a traditional dispensary like in the US, but it seemed like they were really busy in terms of like patients getting access.
Yeah, I think that was, definitely an eye-opening experience, because we were sort of quite fortunate to be able to actually spend extensive time with the team managing the pharmacy kind of towards the close of business. But I think what was absolutely insane was just how many scripts they were processing and working through, and having to wait for this very long line to finally get serviced, and before being able to meet the team. But what was quite phenomenal was looking at the broad range of products in the market, where those products were coming from, how sort of patients were discerning between various brands and reasons for making certain decisions, and also the the important role that a framework that all the stakeholders understand plays in sort of the growth of the industry. So, for example, that particular pharmacy had a backlog of hundreds, if not thousands, of scripts that they actually needed to fulfill. But then, you had a situation where individuals that were patients had confidence in sort of the framework under which these products were being approved, and individuals where sort of cannabis was never an option or even a thought, were now leaning on cannabis to deal with a whole broad range of medical issues, chronic pain, and inflammation-induced medical conditions and so forth. So in many ways, I kind of saw, sort of what South Africa can do if we sort of also had a very, sort of well-communicated framework, sort of a monograph to help with sort of ensuring a standard is met by local cultivators. And then also the multiplier effect that comes with a really well set up and trusted framework by which patients can access medical cannabis. It was really eye-opening and a lot of inspiration that I think we should take as South African and Africa in terms of domestic frameworks and domestic access that will truly allow the industry to to begin to piece together from some of these engagements with different players in the supply chain and so forth, is that Australia is one of the most active sort of jurisdictions when it comes to the global cannabis industry. So Australian companies are exporting to Europe. They're making acquisitions in Denmark, let's say, importing from different parts of the world. But that the fact that domestic industry and the need to service that domestic industry really creates a lot of sort of strong foundational touch points that allow that industry to actually grow and evolve and learn quicker than an industry that's only set up for exports, as an example. And so the conversations that the cannabis sort of stakeholders or operators are having are sort of 3, 5, 10 years ahead of where we are right now. Talking about collective R&D initiatives where the government can fund the R&D, because a lot of these startups in cannabis don't have the resources to invest in very expensive trials, etc. But in a partnership with government and the sector, this IP can then be sort of developed by these private companies that can export the IP to other countries and other parts of the world. So it kind of really puts a spotlight on the importance of sort of, let's say, taking really important, really key steps in developing a domestic industry, which then adds fuel to the ability of that industry to really learn and develop and integrate globally. And ultimately over a 5, 10, 15-year period, that is some of the core ingredients that will allow that country to be a global leader when it comes to the cannabis industry. So I think it's some very, very important lessons for us as sort of South Africa, Lesotho, and Africa in terms of shifting a gear up in the way that we're looking to develop our industry.
No, awesome. I think you've covered there. I was going to ask you about points of improvement, and I think you've kind of really comprehensively covered it. I mean, TGA, who's the regulator, so our version of SAPRA in Australia, always been very, compared, very transparent. I'm sure there's people in Australia that still feel TGA can always be more transparent, as it is with all regulators and every jurisdiction. But it's one where I think there's been clear guidelines, TGO 100, 93, the expectations in terms of GMP certificates that was communicated earlier this year. So I think that's been good. I know also Australia's got a very easy, well, let's just call it they do clinical trials really well. So in terms of the implementation, we do it as well in South Africa pretty well. But Australia is also known for doing good clinical work for countries like Europe and the USA. So they've got that aspect right. I mean, it is a bit overburdening that the CBD products have to move through special access or authorized prescribers. But in that sense, they've made it all pretty clean medical in a traditional sense. And that's forced them to really deal with approvals, which is why it's impressive to see that they can get 100,000 patients onboarded, which makes them quite a big sector in terms of international access. And we'll see, just because they're not really distinguishing too much between a CBD and a THC product, it's the same. It's a medicinal product in their view. I think we will see probably adult use policies coming down the line. We saw the New Zealand referendum some years back, just fell by a small margin. So I think Australia, there's good learning lessons there. And I think it's one where I also see good partnerships between South Africa and Australia for the Southern Hemisphere. So I'm really excited to see how this develops. And Sibs, I know that we've got a lot we want to still talk about. So I'm looking forward to discussing, there's Little Green Pharma, there's Epsilon. There's a lot of interesting companies out there in Australia that are breaking or making big news. Like you mentioned, Denmark Denmark, having acquired a site out in the Nordic region. So it's really exciting to talk some more about this. But Sibs, I'm glad we had you on to quickly capture, the highlights of your trip to Australia, and excited to see future collaborations that you'll be facilitating between South African and Australian cultivators and exporters.
Definitely. No, very, very excited about future collaboration between the two jurisdictions. And yeah, I think there's these collaborations will come at quite a lot of different levels. I think some of our local players are well positioned to execute on some of these, and also a lot of the Australian players as well are very excited about the opportunity to collaborate more with South African and Lesotho based cannabis companies.
Awesome. Excellent.